Welcome to the 2021 Benefit Open Enrollment for ABC Appliance. Today we will be going over an overview of open enrollment, eligibility, summary of changes, review of benefit offerings, and what you need to do. What is open enrollment? Open enrollment is a time when employers review and make any necessary changes to the benefit offerings. It's a time when employees can review and make changes to your elections. Changes outside of open enrollment cannot be made unless you experience a qualifying life event, like a marriage, divorce, birth or placement for adoption of a child, loss of coverage, ineligibility of a dependent. The changes we will be reviewing are effective January 1st, 2021 and will remain in effect through December 31st, 2021 unless you experience a qualifying event. All regular full-time employees working at least 30 hours per week are eligible for benefits. Your eligible dependents include a legal spouse and dependent children. For medical, dental, and vision, adult children can be covered to the end of the month in which they turn 26, regardless of student status. Summary of changes for the 2021 plan year. There is a new carrier for medical and prescription. It will now be offered by Priority Health. Your dental and vision coverage will now be offered by Guardian. New benefit offering, accident insurance, and critical illness. Your health savings account is also available still if you enroll in the PPO with HSA medical plan. The employee max annual contribution has increased for 2021. You can contribute $3,600 for an employee or $7,200 for family, which is 2 or more members. There is also a $1,000 catch-up for anyone 55 and older. The Flexible Spending Account, FSA, has also had a change this year. You can roll over $550 for 2021. Voluntary Life, this is a one-time open enrollment opportunity which we will review. And there are no changes to your basic life AD&D, short-term disability, and long-term disability. As an employee of ABC Appliance, you have several options for benefit elections. Option 1, the employee contribution includes benefit coverage for medical, prescription, dental, vision, basic life AD&D, short-term disability, and long-term disability. Option 2, the employees pay a portion of the full premium as an employee contribution, and the coverage includes basic life, AD&D, short-term disability, and long-term disability only. No medical, prescription, dental, or vision coverage. Option 3 is to waive all benefit coverage. You also, as a full-time employee, are eligible, regardless of what option you pick above, to participate in voluntary life insurance, or voluntary accident insurance and critical illness. This slide here shows option 1, employee contribution, including benefit coverage for medical, prescription, dental, vision, basic life, AD&D, short-term and long-term disability. The column all the way to the right is the employee weekly contribution. Priority Health is your new carrier for medical and prescription drug coverage. For the 2021 plan year, you will be able to elect one of 5 plans. These plans mirror your current BCN and Blue Cross Blue Shield plans very closely. I will go through this. This is a very high-level overview of your benefits. It is in-network coverage displayed only. All of the PPO plans do offer in-network and out-of-network coverage. The HMO plan offers only in-network coverage and is available to Michigan-only employees. The first PPO has a calendar year deductible of $500 for one member or $1,000 for family, which is 2 or more. The second PPO option has a $1,000 calendar year deductible for one member, $2,000 for a family. The third PPO option has a calendar year deductible of $3,000 for one member or $6,000 for family. The PPO with HSA plan has a calendar year deductible of $3,000 for one member, and a family, which is two or more, has a $6,000 deductible. The HMO plan, Michigan only, has a $1,000 calendar year deductible for one member and $2,000 calendar year deductible for family. It's very important to note that if your enrollment tier is two-person or family, then you are responsible for satisfying the full family deductible amount before you will begin to pay coinsurance. Coinsurance for all 5 plans is 80% of approved amount for most covered services. So the plan covers 80% for some larger procedures, and you are responsible for 20%. The coinsurance max, that cost share, is capped for the majority of the plans, and those amounts are listed here. The PPO with HSA does not have a coinsurance max. So again, the coinsurance max is a cap on the 20% out of pocket for some services. Preventative care is covered at 100% for all 5 plans. The 3 PPO plans provide office visit coverage at a copay. You have a PCP office visit copay, a specialist office visit copay, an urgent care visit copay, a virtual visit, which we'll discuss, copay, and an ER visit. The PPO with HSA plan does not have flat dollar copays. You're responsible for your deductible, and then it's covered at 80% after that. Services like radiology and laboratory for the plans have that cost share, so they are covered at 80% after deductible for all 5 plans for radiology. So what that means, based on the plan you choose, you'd have to spend a portion of your deductible or all of your deductible first, and then you have a cost share of 20%, which would be capped at the coinsurance maximum. Laboratory is also covered at 80% after deductible for the PPO plans, but it is covered in full for the HMO plan. All 5 plans also offer chiropractic care coverage, and those amounts with max visits are listed here. This is a very high level overview of your medical plan options. In the new EASE online enrollment portal, there is a benefit guide that has more detail and carrier summaries for all the plans. Your prescription drug coverage is also offered by Priority Health. All 5 medical plans include prescription drug coverage. This here is a listing of the copays and coverage for these drugs. Prescription drugs with a 30-day supply, you have a generic, a preferred brand, a non-preferred brand, and preferred specialty and non-preferred specialty coverage, and the copays are listed. Mail order is a 90-day supply, and that is available for the majority of the drugs listed here. Generic, preferred brand, non-preferred brand, and specialty. However, specialty you cannot do 90-day supply. Understanding your insurance. We just reviewed the coverage for your medical plan and your prescription drug plans. To refresh, the deductible, which each of the 5 medical plans has, is the amount of expenses you pay each calendar year before the plan begins to pay for benefits that have a coinsurance. Coinsurance is after you've met the deductible, the plan pays a major portion of the covered expenses, and you pay the remaining portion. This sharing of expenses is called coinsurance or cost share. For example, if the plan pays 80% for a particular service, Your coinsurance is 20%. Your out-of-pocket maximum is the worst case scenario. The out-of-pocket maximum provides you with financial protection by limiting the total amount you pay for covered expenses in a calendar year. If your out-of-pocket costs reach the out-of-pocket maximum for an individual or family, the plan will start to pay 100% of your remaining expenses for that individual or family for the remainder of the year. The out-of-pocket dollar maximum includes all medical and prescription drug out-of-pocket expenses, including the deductible, coinsurance, and copays. Here's a scenario to help you understand your insurance and how each of the 5 plans would work for you. Pretend an employee has no services, but the wife has an annual physical. 2 children have their annual physical, and the 3rd child has 3 medically necessary office visits to the pediatrician for recurring ear infections. The doctor orders x-rays or radiology. Here's how that would be covered. So if you were enrolled in the first plan, the PPO plan, that's the one that has a $500 individual deductible or a $1,000 family deductible. The services rendered would be a well woman visit that Priority Health might be charged, or the provider might charge $150. Your child has some pediatrician appointments and annual visits for physicals. Maybe that's charged $170. There are 3 PCP visits totaling $255. Your child that has that reoccurring ear infection needs some x-rays or radiology. That's over $1,000 charge. So the total amount billed for all those services to Priority Health is $1,593. So what can you expect to pay depending on the medical plan you choose? Let's focus on the first option. Option 1, PPO plan with a $500 or $1,000 deductible. The services performed, the well visit, is covered at 100%. The children's physicals are also covered at 100%. The PCP visits, there's 3 of them, that's covered at an office visit copay. And the x-rays go towards your deductible and coinsurance. So for Plan 1, you'd be responsible for your $500 deductible, a coinsurance or that cost share of $103.60. The medical copays would be $60 total for 3 of them. So the employee's cost for services for those services performed is $663.60. The next line here shows you if on an annual basis what your employee contributions are for that plan. So for the PPO 1 with the $500, $1,000 deductible, your annual employee contributions for that family coverage is $14,754. So to put it in perspective, that plan would cost you, and those services would cost you over $15,000. That's for the services rendered and your annual employee contribution for family coverage. Those same services, if you chose option 2, the PPO plan with a $1,000 individual deductible, $2,000 family, would have the $1,000 deductible come into play, $3.60 for coinsurance. Your medical copays are $30 a piece, so 3 times 30 is $90 for the copays. So the employee's cost for those services would be $1,093.60. Based on the employee contributions, that total would be $12,110.80. The third plan, PPO, with a $3,000 individual deductible and $6,000 family deductible, would have the women well visit covered at 100%. The child's physicals would be covered at 100%. Then office visit copays and deductibles and coinsurance would come into play, similar like the first two scenarios with the PPO plans. This one here, the PPO 3, you'd spend $1,018 out of pocket for the deductible and $90 for the medical copays, totaling $1,108 for those services rendered. Your payroll contributions for that third plan are lower. Those would total $8,354.32. So your total employee cost would be $9,462.32 for that plan. That's for the services rendered and for your annual contribution. The fourth option is the PPO plan with HSA. So again, same services incurred, well woman visit covered at 100%, children's visits covered 100%. You have some primary care visits, they're covered at a deductible and coinsurance amount. And then the radiology or x-rays has a deductible and coinsurance. So for this plan, you're going to spend $1,018 for your deductible, $255 for your medical copays, totaling $1,273 for the services rendered. Your annual employee contribution for this plan is quite a bit less. Your annual contribution is $5,409.56 in employee premium for the year. So with those deductions and the services rendered, your employee cost would be $6,682.56. The last plan is the HMO plan. Again, this is for Michigan-only residents and only offers in-network coverage, which this example shows in-network coverage. The women's well visit would be covered the same, 100% coverage. The child physicals would be covered at 100%. The PCP visits are covered at a copay, and then the radiology is covered at a deductible coinsurance. This HMO plan, you would pay out the $1,000 deductible, $3.60 for coinsurance, $60 for the copays for the PCP visits, totaling $1,063.60 for services rendered. From a payroll contribution standpoint, on an annual basis, this plan would cost you for family coverage $5,410.08. Total out of pocket would be $6,473.68. So what this example is showing you, not only what your out-of-pocket expenses would be for the same services, but the difference in annual employee contribution and how that affects your bottom line. With Priority Health being your new provider and medical care carrier, it's very important to check to see if the doctors that you participate with now through Blue Care Network or Blue Cross Blue Shield are participating with Priority Health. You can do that by visiting www.priorityhealth.com. Because you won't have your ID card yet, these are the steps it would take to see if your current doctor, facility, or hospital are in network with Priority Health. So you visit that webpage, you're going to scroll all the way down to the bottom. In the lower right-hand corner, you're going to look for Find a Doctor. Click on that, and then you're going to choose your location by entering your zip code. And it can be the zip code where you live or close to work, wherever you would like to go to the doctor's office or provider's office. After that, after entering your zip code, you're going to select your plan type by clicking Employee or Group Plans. Then, depending on what you're looking at, you're going to select either Priority PPO or Priority HMO for the two plans. The next screen, it will take you to an area where you can search by doctor, name, specialty, or place by name or type. So if you want to check to see if your current doctor is in network with Priority Health, you just enter their name and search. Or if it's a hospital you like to visit, enter the hospital visit information and hit search. Again, it's very important to see if the doctors that you like to visit and that you're comfortable with are participating in network with Priority Health. After you receive your card, so after January 1st of 2021, you can log in and register for an account at member.priorityhealth.com. You can click on My Plan and then select Find a Doctor. You will search also by providers based on your specific plan type, so you'll get to see doctors directly in your network. This is different than the original page because you're actually entering your information in there. The initial results will show primary care doctors within 25 miles of your home address. You do have the option to change the location to what's most convenient for you. You can choose a doctor from the list or use filters like specialty doctor, doctor name, and other criteria to narrow your results. If you live outside of Michigan, you have a PPO plan only. You can also search for providers and receive care outside the state of Michigan. You go to www.priorityhealth.com/find-a-doctor. Need to choose or change a PCP? You can select or change your primary care provider at any time by clicking Select PCP. The Priority Health HMO is offered to Michigan-only employees. The Priority Health HMO network is very large. Members have access to the entire HMO network of providers that include about 97% of the providers in Michigan. It's important to choose a PCP. These are important because they help maintain your overall health. PCPs are responsible for coordinating care so members can receive the right care in the right place at the right time. If you don't choose a PCP at the time of enrollment, you will be assigned one by Priority Health. But this can be changed at any time. What about referrals? Great news! Priority Health does not require a PCP referral to see an in-network specialist. This is different than the current BCN HMO plan. This means it's easier for you to choose the in-network specialist that's right for you, helping you be in better control of your health care decisions. When you're in the enrollment platform through EASE, it does require you to enter a PCP number. There is a drop-down list of some of the local providers that you may currently be using. If you don't select a PCP, you will be assigned one. It's very important while you're choosing your benefits to also register for accounts and download the mobile apps. Priority Health has online access. My Health gives you convenient access to your most important information in one convenient place, including renewing prescriptions, scheduling virtual doctor visits, the cost estimator tool, which allows you to check prices for healthcare services. You can check your accumulators, seeing where you are in your year-to-date deductible, your annual coinsurance max, and your annual out-of-pocket max. Priority Health virtual visits. These are offered to you 24/7 virtual care when and where you need it. What is virtual care? Virtual care gives you access to board-certified doctors on nights, weekends, and even holidays for health issues that aren't an emergency. Virtual care connects you with a doctor over the phone, through video, or simply by filling out an online questionnaire. Depending on your condition and the type of virtual care you choose, a doctor can prescribe a medication and send it to your preferred pharmacy, develop a treatment plan, notify your primary care doctor with the current information, and help you make follow-up recommendations, including referrals to see a specialist. What kind of conditions can virtual visits treat? Again, it's great for non-emergencies like cold, cough, flu, a fever, nausea or vomiting, sinus problems, pink eye, allergies, bites, and stings. New this year, Guardian will be offering you voluntary accident insurance. Any full-time eligible employee may elect this coverage, regardless of what plan they choose for medical or basic life coverage. Every employee that is eligible can participate. Voluntary accident insurance pays you a lump sum benefits after you suffer an accident. It could be something like a severe burn, a broken bone, or an emergency visit. The accident insurance policy also offers a special benefit that pays extra for children injured while playing an organized sport like soccer, baseball, lacrosse, or football. Here's an example of some of the injuries and the benefits that you could receive. Please refer to the carrier summary and the benefit guide for more details. Benefits are only payable once per covered accident, and the covered treatment or service must occur as a result of an accident. New this year, Guardian is offering all eligible full-time employees the opportunity to enroll in voluntary critical illness. Voluntary critical illness insurance can pay more money directly to you when you're diagnosed with a certain serious illness. You can receive a benefit payment in one lump sum, and you can use the money however you want. There are two options. An employee may choose a lump sum benefit of $10,000 or $20,000. You can also purchase coverage for your dependents if you enroll yourself. A spouse can enroll in 50% of the employee benefit amount, which is $5,000 or $10,000. Children are eligible for 25% of employee benefit amount. The child cost is included with the employee election at no additional charge. Dependent children are eligible until the day they turn age 26. Here's an example of some of the treatments, some of the covered conditions, and based on occurrence, what kind of benefit you would receive. Please refer to your benefit guide and the carrier summary for more details. As I stated, all full-time eligible employees can participate in the voluntary accident insurance and voluntary illness, regardless of what medical plan they enroll in. Here are the weekly premium amounts for these coverages. Health Savings Account offered by Health Equity. This is available to you if you enroll in the Priority Health PPO with HSA plan. A health savings account are designed to help you save and pay for future medical expenses or current expenses, if large or unexpected. They are used in conjunction with a qualified, high-deductible health plan. Employee can contribute dollars on a pre-tax basis. Here's a listing of the annual contributions for 2021. One member can contribute $3,600 for the year. There is a $1,000 catch-up for 55 and older. A family, 2 or more members, can contribute $7,200 for the 2021 plan year and an additional $1,000 catch-up for 55 and older. Health Equity has an online member portal. The online member portal is a powerful tool that gives you access to all account management features. Visit www.myhealthequity.com. Here are the login instructions. You're able to receive e-statements, view account balance, pay a claim, or request reimbursement, do a point of sale payment through your debit card, upload documentation, view claims, or contact Health Equity. If you are not participating in the Health Savings Account, you are eligible to participate in the Healthcare Flexible Spending Account offered by AmeriFlex. A healthcare FSA covers healthcare costs not covered by the other benefit plans, including eligible medical, prescription, dental, and vision services. For the 2021 plan year, you can put up to $2,000 into your healthcare FSA. The funds will be available immediately. There is a debit card available. If you enrolled in the FSA during the current 2020 plan year, your existing My AmeriFlex debit card MasterCard will continue to work for 2021. New enrollees will receive a debit card mailed to your home within 12 to 14 business days in an unmarked white envelope, so don't throw it away. You are not eligible to enroll in the Healthcare FSA if you are enrolled in the PPO with HSA Medical Plan. It's very important to remember to save your receipts. The Healthcare FSA has a carryover feature. If you're currently enrolled in the 2020 Healthcare FSA plan, you can roll over up to $550. This carryover funds will be available January 1st of 2021. The carryover amount does not apply to the maximum election for the following year, so you can still contribute up to $2,000 and carry over up to $550. For the 2021 Healthcare FSA plan, this also has a carryover. You can carry over up to $550 at the end of 2021. This plan year runs January 1st of 2021 through December 31st of 2021. Carryover funds will be available in January of 2022. Again, the carryover does not apply to the maximum election for the following year. The Healthcare FSA is a use or lose it, so carefully determine your annual healthcare election amount and your spending during the plan year. Although there is a $550 rollover option, any additional amounts will be forfeited. There's also a run-out period. You have a run-out period of 90 days following the end of the plan year, so the end of 12/31 of 2021, to submit claims for services incurred from the previous plan year, where you have until April 1st to submit claims. Claims for services incurred during the 2020 plan year must be submitted by April 1st of 2021. All claims submitted during the run-out period, so during January 1st of 2021 to 3/31 of 21, must be submitted manually through the AmeriFlex FSA mobile app, online portal, or via paper reimbursement form. You cannot use your AmeriFlex debit MasterCard for 2020 claims after 12/31 of 2020. This is how your flexible spending account works. You're currently in the 2020 plan year, which runs January 1st through December 31st. You're incurring claims. At the end of the plan year, you have the option to carry over $550 into the next plan year. Those carryover funds will be available on January 1st of 2021, and they get directly deposited into your 2021 Healthcare FSA account. The 2021 Healthcare FSA account allows for claims incurred January 1st through 12/31 of 2021. Also during the current plan year, you have the run-out period, where you can run out and get your receipts. You must submit these claims manually. You cannot use your debit card. These claims during the run-out period are being applied to your 2020 Healthcare FSA. You have until April 1st to turn in receipts for the 2020 plan year. AmeriFlex also offers you the option to participate in a dependent care FSA. This is eligible for all full-time benefit-eligible employees, including those that are contributing to an HSA. The Dependent Care FSA covers costs of daycare expenses. For the 2021 plan year, you can put up to $5,000 into your Dependent Care FSA. The funds accrue, so you can only be reimbursed for up to the dollar amount currently in your account. Unlike the Healthcare FSA, there is no carryover, so it is a use or lose it situation. You do have a 90-day run-out period following the end of the plan year to submit claims for services incurred from the previous plan year. New this year is Guardian Dental. ABC Appliance offers dental coverage when you elect medical coverage through Guardian. The dental is a PPO and utilizes the Dental Guard Preferred Network. For in-network and out-of-network services, there is no calendar year deductible. Both in-network and out-of-network allows for an annual benefit maximum of $1,000 per member. There is orthodontic coverage and a lifetime maximum of $1,000 for children up to age 19. Preventive services is covered at 100%. These include things like oral exams, cleanings, x-rays, fluoride treatment, sealants, and more. Basic services are covered at 65% for in-network and 50% for out-of-network. Basic services includes fillings, perio maintenance, periodontal services, simple extractions, bridges and dentures, and general anesthesia. Major services like bridges, dentures, crowns, inlays, veneers are covered at 50% for both in-network and out-of-network. Orthodontist services is eligible for dependent children under the age of 19, and it's covered at 50%. The orthodontia in progress is covered for both in-network and out-of-network. The Guardian Dental PPO plan offers two value-added benefits. One is the dental maximum rollover. Members can accumulate annual maximum dollars with maximum rollover. Guardian will roll over a portion of each dental guard member's unused maximum, so if you don't use that full $1,000, can be rolled into future years. Please see your benefit guide for more details. The dental PPO also offers you college tuition benefit. It's the opportunity to earn annual tuition rewards that can be used over 345 institutions. Visit www.guardiancollegetuitionbenefit.com to get more information and register. Also look in the annual benefit guide. New this year is vision coverage offered by Guardian. Again, if you choose option 1, the vision coverage is included when you elect medical coverage. The Guardian Vision Plan uses the BSP network. You can see that there's in-network copays for eye exams, lenses, contact lenses, and frames. You can receive an eye exam once every calendar year. Lenses for glasses once every other calendar year. Contact lenses once every other calendar year. And frames once every other calendar year. Members need to choose between prescription glasses, lenses and frames, or contact lenses, but not both. By Guardian providing your vision and dental coverage, you can access your account online by visiting guardianlife.com. You can also check for provider to see if your current dentist or vision provider is in network. You can print your ID card at any time through Guardian Anytime. You can also access an array of tools to help you understand the value of your benefits. And there's real-time assistance should you need to speak to a guardian representative about your benefits or any claims. Basic life insurance AD&D is offered by Guardian. You are eligible for this benefit if you choose option 1 or option 2. It is an employee paid coverage. Employee basic life coverage is equal to 1 times your annual earnings, rounded to the next $1,000. This amount cannot exceed $50,000. Employee basic AD&D is equal to 1 times your annual earnings also, rounded up to the next $1,000. This amount cannot exceed $250,000. The definition of earnings includes salary, bonus, commission, and overtime in this calculation. You do have a benefit reduction schedule and added features like conversion, portability, and waiver of premium. Again, the basic life AD&D coverage is offered through option 1 or option 2. Voluntary life is also offered through Guardian. This is available to all full-time eligible employees regardless of what medical plan or option you take. There is a one-time open enrollment opportunity. You have the opportunity to enroll in a voluntary life for you, your spouse, and dependent children up to the guarantee issue with no medical questions. This is an employee paid coverage. Voluntary employee life is available in increments of $10,000 to a maximum of $200,000, not to exceed 5 times your annual earnings. The guarantee issue is $200,000. So you can enroll now with no medical questionnaires in increments of $10,000 up to $200,000 for an employee. There is a benefit reduction schedule. Dependents, including your spouse and children, can also enroll in voluntary life, as long as you, an employee, elect coverage. For a spouse, they can elect 50% of the employee benefit amount to a maximum of $50,000. The guarantee issue is $30,000. So you can enroll your spouse up to $30,000 worth of coverage with no medical questionnaires. Coverage for your dependent children is also available in 2 options, a $5,000 benefit or a $10,000 benefit. The guarantee issue is $10,000, so no medical questions are required. Dependent children are eligible 15 days to age 26. Children live birth to 14 days are eligible for a $500 benefit. This is a one-time opportunity during open enrollment to enroll in voluntary life if you previously waived coverage. Voluntary short-term disability is provided if you choose option 1 or option 2. It is employee paid. Voluntary short-term disability is a valuable benefit designed to replace a portion of your income when you are unable to work because of a non-work-related injury or illness. The weekly benefit is up to 60% of your weekly earnings, up to $500 per week. There is a 30-day elimination period due to injury or illness. The maximum benefit period for short-term disability is the end of the disability or the 180th day. Voluntary long-term disability is offered through Guardian. This is available to you if you choose option 1 or option 2. It is an employee paid coverage. The long-term disability benefit is a monthly benefit up to 60% of your monthly earnings, up to $5,000 per month. There is an Employee Assistance Program, EAP, available to you. Work-Life Matters, provided by Guardian. These benefits include financial, legal, and family services and are available to you and your immediate family members. There is an elimination period for the long-term disability, and the definition of earnings is defined. If you choose option 1 or 2, you automatically are enrolled in the Employee Assistance Program. It's provided at no additional cost to you when you have long-term disability coverage. Employee Assistance Program offers an array of confidential services to help you and your loved ones meet the challenges that life, work, and relationships can bring. It can help you with education, dependent care and caregiving, legal and financial, lifestyle and fitness, and working smarter. With the EAP service, you have unlimited telephonic consultations available 24/7. You can be referred to local counselors and get up to 3 sessions free of charge. It is 100% confidential. Here's the contact information. This information is also available in your benefit guide. What you need to do. Now is the time to add or remove dependents and change your elections. As a reminder, you have several options to choose from. Option 1, your employee contribution enrolls you in medical, prescription, dental, vision, basic life AD&D, STD, and LTD coverage. Option 2, with your premium payment, you're enrolled in basic life AD&D, short-term disability, and long-term disability only. You do not have coverage for medical, prescription, dental, and vision. Voluntary life, you're eligible to enroll regardless if you enroll in option 1 or 2 above. Same with the voluntary accident and critical illness. All eligible full-time employees can participate, regardless if you choose option 1 or option 2. Benefit elections are in effect from January 1st of 2021 through December 31st of 2021. No mid-year changes are allowed unless you experience a qualifying life event. Complete the elections in the new online enrollment portal, EASE, no later than Monday, December 7th. Any questions? Please contact Human Resources, Pamela Hambley, or a representative from Marsh & McLellan Agency. Our employee benefits consultant will be hosting virtual office hours to answer any questions you may have about your 2021 benefits. They will be available on Wednesday, November 25th, Monday, November 30th, and Tuesday, December 1st.